I'm gonna come over here and I'm gonna get my supplies that I need for intraoral. So, I need my patient bib. I need my Q-tip. I need a 2x2. I need my tongue depressors. And let's see. Okay, I'm gonna first put her bib on. I'm gonna check now the inside of your mouth. I'm gonna get my patient glasses here, and if you could please put those on. At this time, if she has regular glasses, she can leave them on. I mean, I can give them back to her, because remember, we took them off for the extra oral. If she has her own, she can put them back on again. And then I'm gonna ask her if she has any partial plates or anything that's removable in her mouth. No. And she does not. But I would take those out at this time and put it on my tray, okay? I will put my ear water.
If she has regular prescription glasses, should we give her the tabs?
I mean, I think it depends. If she has like some little tiny glasses, you might want to, but yeah, you can decide on that, but yeah. And I'm going to put my ear water in here because you're always going to want to have that ready whenever you need it. And you have to find that little hole here. So you're going to do that. Press that outer ring in. And then remember what I told you guys, always check it. Okay, good. All right, so now I'm going to come over and I'm going to recline her. It's okay that you recline all the way?
Yes.
Okay. Make sure she doesn't get dizzy or anything. Lower the chair. Okay, here's where the list. I'm going to, do you have the list in case I miss anything, but you're going to observe just the outside of the face again. I already did the extra oral, but I'm going to look at her lips, the lining of her lips, vermilion border, or now it's a new term. See if she has any crackings in her commissures. Just look at her overall. Remember when she first came in, I checked to see if she had any swelling or if I noticed any odor, maybe alcohol or anything. Just kind of noted that in my head when she walked in. So she's good there. Now I don't touch her yet, right? Because I don't know if she has anything that I could spread in her mouth or any reason I cannot treat her. So I take my tongue depressor and I just use it and I go all around to just pull her lips back, check out her buccal mucosa, like that, pull her lips up, good. Can you open your mouth a little wider? Okay, lift up your tongue. Okay, pull out your tongue, yeah, okay, good. Okay. She's good. There's no reason that I so far can tell. And I'm going to take this, very important, and I'm going to throw it away. The first one I'm going to throw away. Now, so the first is the tongue depressor. The second is the mirror. Still haven't touched her with my fingers. Same thing, but now I can see a little more detail because now I can illuminate, right? What are the 4 uses of the mirror?
Illuminate, translation, direct. Is it direct?
Retraction. And indirect vision, right. Yeah. So now I can look, I can see the hard palate a little better now because I'm using my light, using my mirror. And now that I have a better look with now the mirror, I'm still feeling confident that, yeah, she looks good, that there's no reason I cannot touch her now with my fingers. Okay, so I can put that down, and now I can touch her with my fingers. Number 1, tongue depressor. Number 2, mirror. Number 3, fingers. And here's where I might get the order a little mixed up, so you might want to just check me, but you're going to go around to her lips, And let me know, Tessa, if there's any details I miss. Open nice and big. You're gonna check her buccal mucosa. You're gonna palpate on the inside. You're gonna use one finger on the outside and one on the inside, because you don't want to get that finger that's all wet from her saliva, and you don't want to put it on the outside of her mouth. So you kind of just go like that. Or you could use two fingers too if you want to do it, as long as you just don't get the outside of her face wet. Okay, good. I'm going to go probably in a different order, but you're going to feel the floor of the mouth. So you're going to support the bottom of her chin here, and as you move around and as you push down on the floor of the mouth, you're using your fingers as a place to press a little bit harder, and you can feel all around. You feel me pressing down?
Mm-hmm.
Yeah. Okay. Good. Should I do? Let's see. I want to make sure Okay. So then you would take your fingers and you would rub all around on the gingiva, all around on the inside. What am I feeling here? What could I feel here if I feel the bone? What else?
Canker sores or
Canker sores, tori, abscess, right? I mean, I know I looked at it, but I didn't feel it. So now I could feel maybe a bump, an abscess if she had an abscess. And then open nice and big. This is always a little ticklish when you feel the hard palate. Okay. Tessa, just make sure I don't miss anything. I'm all out of order, but just make sure I don't miss anything. I'm going to check out her tongue now, and I'm going to wet it because I already had this ready, right? So I'm going to...
Did you already do the ducts?
No, not yet. Yep.
That's
Because yeah. So we'll do the tongue, and then I'll go back to the ducts. So I've wet my gauze for comfort for her. I'm going to have you stick out your tongue, and I'm going to put this gauze on you so I can look at your tongue the whole length. Open a little bit more. She has a very small tongue. I'm looking at the lateral borders. I'm looking as far back as I can there with that. Good. And now, after you take that gauze off, you're looking at the tip of her tongue that you covered, right? You want to be able to see that you didn't miss anything there. You're going to palpate her tongue, which is also a kind of a weird feeling. Stick out your tongue a little more for me. Thank you. Palpate it. Feel, see, if you feel any bumps or anything. Good. I'm going to have you lift your tongue up for me, Kim, please. Yeah. And then I'm going to have you put your tongue out again, and then I'm going to have you say ah. Ah. Good. So when she did that, I could see her uvula, I could see the anterior fossa, the tonsils, all that. Okay. We're going to check the salivary glands, right? If you use a mirror, which you can, to retract, Kim, if you can come towards me a little bit, and I'm trying not to touch the outside of her face because my gloves are going inside, but I'll just guide her. If you use this to retract, just make sure you don't cover the gland with the mirror, because you can sometimes, and you can say, oh, I don't see hers. Well, you could be covering it. Also, you never want instruments in your hand when you're moving this. You never want to do this, right? You're going to transfer it to this hand, and then you're going to go like this. Never put instruments in your hand and move the mirror at the same time. So, if you see, when I pulled the mirror there, I actually covered it. So I moved over, and there it is right there. So if you just move it around a little bit, if you're lucky, you'll get a nice big drop of saliva out. I did not, but that doesn't necessarily mean she has a problem, because I can see already just by looking in her mouth, it's pretty moist. Her mouth isn't dry. You would check the other one as well. And I almost covered it again with the mirror, but then I moved it over. And just move it around there and see if you can get a drop of saliva out, which we did not. Okay, and then you're going to lift up your tongue. We're going to look at that Wharton's duct there. And we're going to move these glands around to see if we can get any water, any saliva to come out, but we're not getting any. Okay. You're going to look at that lingual vein. Again, this is just process, so you don't need to know everything yet, but we're looking at the plica fimbriata. plica fimbriata. I don't know if I showed you. If you use the air, open nice and big. If you use the air, I'm gonna put some air on your tongue.
It's really hard to see with the light.
Do you see that tissue moving around? That's the plica fimbriata. Okay. So we checked that there. Anything else I missed so far? We did the floor of the mouth. She has a little tori on her hard palate.
The
molar region.
The molar region, okay, the maxillary tuberosity. Okay, so thank you. Maxillary tuberosity is way back here. You're going to palpate it. And that's the area behind her last molar. And then her retromolar pads, same thing, the area past her second or third molars, depends on what she has.
Triangular raphe.
Okay, so that's when I had her, open again for me, when I had her stick her tongue out and say, ah, I was able to see that. So stick your tongue out again and say ah for me. Ah. Okay, so not real good, but you can see it the best that you can. And then, actually, I think in there, at the end, it has you use this second tongue depressor to say ah. I was using the mirror, but just use this at the end. So again, one more time, and ah. Good. You don't want to bring this too far back because it can gag her. Is there any areas, and do you know of any areas that I missed? Remote pad, ducts, tongue. And the only thing I wanted, when I had, can you stick your tongue out again? When I had her stick her tongue out, I did palpate the dorsal, but I didn't palpate the lateral borders. Make sure you do that as well. I think we covered everything, right? Now, as you notice, I didn't go in order, but I didn't miss anything. So as long as I see that you checked the salivary glands, you palpated, you did the floor of the mouth this way, you got everything. I didn't go in order, but I got everything, so it's fine. Kim had the advantage of feeling the pressure that I used. When I did that floor of the mouth, I really pressed down in there. It's hard to tell because you're only watching me, but Kim can feel. You feel that pressure. Okay. And even with the buccal mucosa, I'm really just feeling all around, pinching her lower lip and her upper lip like that. Okay. I thought maybe looking at her philtrum. That was the outside when I first sat her down. I looked at her lips. And the philtrum is right here. Hers isn't as pronounced. Yours is more pronounced.
Do you have a partner who needs a partner?
Oh yeah, we do. Yeah.
There you go.
Okay, thanks. That's her philtrum right here. You can come over here. So you're just kind of looking overall when we first start.
With the commissure of the lips is like.
I did mention
open.
that. Yes,
Yeah,
the
open
commissure
and,
is right here.
Can let ask the patient to open and check if she has the pit.
Yeah.
Oh yes, open nice and big. Yes, that's right. She doesn't really have it too pronounced, but yeah.
And I think also it acts to like pull the lips up to check like the vestibule in that area.
Oh, okay. I think I did that with the mirror
The blade.
before.
Do you just, oh, okay, I see what you meant.
Yeah.
Just,
With the
you don't
blade.
have to like pull it all the way up. You just have to
No,
look.
as long as you can see, and they were going over your eyes.
Oh,
Yeah. So, crucially what I'm looking at is, what's the first thing you use?
Your tongue depressor,
The tongue depressor.
What's the second thing you
your
use?
mirror.
And then the third thing?
Your hands.
Your fingers, okay? And then just palpating and doing the process, checking everything. You're gonna, you don't have the nose, so you're gonna, it's better that you just remember all the things you need to check, not so much the order, so as long as you cover everything. Okay? And as long as you're not making any big mistakes, like I said, don't do this. Don't move the mirror, the light with anything in your hand. So you would transfer and then go like that. Always make sure she has her glasses on. Right? Now that I showed you, I know you came in at the tail end, but piece of cake, right?
Mhm.
You got this.